Okay, hi guys. Today we want to look at gross anatomy of the infratemporal fossa. All right, so what I have here on my hand is the cranium or the skull, right? Um, so when we talk about the infratemporal fossa, we are looking at the lateral aspect of the skull bone. And if this is a temporal region, the infratemporal region would be right inferior to the zygomatic arch. So this is the zygomatic arch. All right, so don't mistake, that's the zygomatic arch. So by definition, the infratemporal fossa is an irregularly shaped structure. So I'm going to put my hand, my index finger, in the infratemporal fossa right here. That's the infratemporal fossa. Make sure your hand is not going, your index finger is not going beyond the zygomatic arch. So that's the infratemporal fossa. From the definition, it is an irregularly shaped structure. So it is irregular. So let's find out that. So it is very irregular. It doesn't look like a square. It doesn't look like a rectangle or a triangle, but it is just irregular in shape. So it is an irregularly shaped space that is deep. It is deep, of course, it is deep. Look at that. It is very deep. It is deep, and at the same time, it is inferior. It is inferior to where? It is inferior to the zygomatic arch. It is inferior to the zygomatic arch. All right? And deep to the ramus of the mandible. It is also deep to the ramus of the mandible. It is deep to the ramus of the mandible. Alright, so let's see. It's deep. Look at that. It is deep to the ramus of the mandible. And finally, it is posterior. It is posterior. It is posterior to where? It is posterior to the maxilla. It is posterior to the maxilla. Let's see. Let us use this because it is important that anatomy deals with precision. You have to be sure of what you're describing. So it is irregular shape. So we know it is irregular. It is deep and inferior to the zygomatic arch. So this is zygomatic arch. So definitely it has to be somewhere there because it is inferior. It is also deep to the ramus. So that's the ramus. So it's got to be deep to the ramus and posterior to the maxilla. That's the maxilla. This is the maxilla. This is the mandible. It is posterior to the maxilla. So it got to be somewhere here. That's the space we're talking about. Now, why are we talking about this space? The reason why we are talking about this space is because of the content of this space. In the previous video that we did mention the content of the space. So we say it has muscles. So there are important muscles that are found in that space. And these muscles are definitely innervated by some nerves. Okay? And these nerves have ganglions. So you're going to have a ganglion in that space. Okay? And because muscles are there, definitely they will have arterial supply. And of course, they will have a venous drainage. Makes sense, right? Okay? So these are the contents. So let us find out what are these structures, to be very precise. So the muscles are the lateral and the medial pterygoid muscle. the lateral and the medial pterygoid muscle, as well as the inferior part of the temporalis muscle. The temporalis muscle. How about the nerve? So basically it is the mandibular nerve, and we know the mandibular nerve is a branch of the trigeminal nerve. So we also have the inferior alveolar nerve. The inferior alveolar nerve is there. The lingual nerve, the buccal nerve, all right, and of course a branch of the facial nerve, which is a caudal tympani. The caudal tympani nerve is there. How about the ganglion? We have the otic ganglion there, okay, which brings glossopharyngeal nerve there, which synapses in that ganglion. And then the artery that is there is the maxillary artery. The maxillary artery is, we're going to be talking about the maxillary artery in a short while. The maxillary artery is a branch of the external carotid artery. Take note of that. And the branches of the maxillary artery are numerous in that region, that it is important that we talk about these branches in our subsequent lecture. And one important branch of this maxillary artery that is of clinical importance is the middle meningeal, artery, and the accessory meningeal artery as well. But most important is this, because in USMLE questions you'll find these artery being queried about. And how about the venous plexus? So we have the pterygoid, venous plexus. So these are the contents of the infratemporal fossa, right, that we need to talk about. Now, we're done with this. The infratemporal fossa would not be complete if we do not talk about the parotid region, which we talked about in the previous video. And when you put these together, the infratemporal fossa, or the infratemporal region, and the temporal region, as well as the parotid region, you will be arriving at a very important joint called the TMJ, the temporomandibular joint. Now, what is a temporomandibular joint? The temporomandibular joint, so let's talk about the temporomandibular joint in a short while. I'm going to take this off. Right, I'm going to take this off, and then we'll talk about the temporomandibular joint. Right, good. Let's talk about the temporomandibular joint. The temporomandibular joint, TMJ, is an example of a modified, so it's a modified type of hinge joint. It's a modified type of hinge joint. Now it has its functions. And one of the functions of the TMJ is actually, so let's see what my skull has. So this is the TMJ. That's the TMJ. That's the temporomandibular joint. In anatomy, we usually have terminologies, and these terminologies is a result of bringing different words together to make a single word. So we are carpenters of words. So that's the mandible, that's the temporal region, and you have a temporomandibular joint there. It's a kind of hinge joint, but it's more modified, it's more specialized than the ordinary kind of hinge joint that we see. So this is hinge joint at the level of the elbow. So all you just do is a back and forth movement. Or you're opening the door, and you just open the door and close the door, and that's a hinge kind of movement. But here, the temporomandibular joint is different when we talk about these kind of movement at the joint. So here we have, why is it different? Because we have a gliding kind of movement. There is a gliding kind of movement. And there's also a rotation at the TMJ. There is extension at the TMJ as well as flexion at the TMJ. Alright, the gliding kind of movement that is established at the TMJ is translational. It's translational movement that brings about protrusion and retrusion. So it brings about these two movements, protrusion and retrusion, which I'm going to show you right now. The rotational kind of movement is a pivot movement, or a pivot kind of movement, a rotational kind of movement at a fixed point. And the extension is more of a depression kind of movement. And the flexion is more of an elevation kind of movement. Now what do we have here? Let's see what we have at the TMJ. So we have, if it is to be a normal kind of hinge movement, we would have this up and down movement. Think about it. If you were to chew like that, I don't think you'll be doing a good job if you were to chew. So you find that there is a gliding kind of movement, which is translational. That's protrusion, and this is retrusion. And there's a rotation. You see that? Most persons, when they chew, that's what we do when we chew. All right? And then there is depression, which is extension, and then there is elevation, which is flexion. So those are the kind of movements that you find at the TMJ. Now let's look at the joint itself. These movements would not be possible if these muscles of mastication are not there. So the muscles of mastication are the temporalis muscle, which we would see, the lateral and medial pterygoid muscle, as well as the masseter muscle. So let's see from a diagram, let's see what's going to happen when we look at the diagram. Let's look at a diagram. All right. So we have let's have this as a skull. That's the mastoid process of the temporal bone, and that's your styloid process. And somewhere here you have the head of the mandible, and that's the coronoid process. Alright, so just giving you that outline, and that's the maxilla. Okay, so we have this. All right, so this is kind of a representation of the human skull. All right, so we have here as the zygomatic arch, and that's the eye, and you have that. Okay, and then you have your suture lines that goes all the way there. That's the coronal suture, And we have this going all the way, coming down like that. And that's your pterion, which we'll talk about later on. So what we're saying here is that we have right here is your external acoustic meatus, and the TMJ is right there. That's the TMJ. So that's the joint capsule, and that here is the mandibular fossa. And of course, you know, you have, if I'm going to take this off, I'm taking the coronoid off, so I'm exposing the lateral pterygoid plates, and the lateral pterygoid plate actually do form a fossa there, which is the pterygopalatine fossa, and attached to that is that's the muscle, the lateral pterygoid muscle, which has two heads. So this one that's crossed is the superior head, and that's the inferior head attached to the joint capsule. Okay? Now what we're going to do here is to take off this portion. We're going to take this portion off and expand that portion. So we're going to take that off. So let's expand that portion. So we're going to take that off and then expand the portion. So that here is our external acoustic meatus. That's your styloid process, and of course that's your mastoid process. Now we have here, this is called the postglenoid tubercle. That's the postglenoid tubercle, and the joint is formed by the mandibular fossa. That's the mandibular fossa. That's the mandibular fossa, and the articular tubercle. So I call this the mandibular fossa, and that's the articular tubercle. That's the articular tubercle, and here is the that's the head of the mandible. That's the coronoid process, and that's the ramus of the mandible. That's the angle of the mandible. That's the body of the mandible. Good. Now let's see, there's a space here. Remember that we have the lateral pterygoid plate. That's the lateral pterygoid plate there. And you have that's your maxilla. That's a little bit too far. So this is our lateral pterygoid plate. And this is your maxilla. Okay, that's maxilla. So the lateral pterygoid, attached to the lateral pterygoid is the lateral pterygoid muscle. That's the lateral pterygoid muscle. It's actually a triangular two-headed muscle. So it looks triangular, and it's a two-headed muscle that is attached to the joint capsule. So this is the joint capsule. So we have this to be our joint capsule. So this is a space, and at the back here is a space. It's covered by a joint capsule, and here is a joint capsule, like a fibro cartilage. Now there's a space here, all right? That space is the synovial space, so that you have synovial membrane. Then we have here an articular disc. That's the articular disc. The articular disc separates the space into two. So we have a superior articular cavity and an inferior articular cavity. So that's the space above. It's called a superior articular cavity, and this space below is the inferior articular cavity. Now what happens is that synovial membrane is there, you have the synovial fluid is there, and they produce these fluid to allow frictionless movement. Okay? Now in terms of gliding, the superior cavity moves, all right? In terms of gliding, those kind of gliding movement and rotational kind of movement, the superior cavity, which is this cavity, moves superiorly. So it slides. There's a translational movement that's happening, and that is taken care of by the superior articular cavity. Now what about the hinge kind of movement? It is taken care of by the inferior articular cavity. All right. Now this here, which is the posterior or the postglenoid tubercle, prevents a posterior dislocation. Usually, the kind of dislocation that you would have on this joint is an anterior dislocation, because the lateral pterygoid muscle is actually attached to the anterior aspect of the head of the mandible, so it pulls it anteriorly. All right, so that can cause an anterior dislocation when you yawn excessively, or you have a blow or trauma to the mandible. All right, so there are other stuff that are involved in reinforcing this muscle. We have some ligaments that are involved in reinforcing this muscle, in reinforcing the joints. So those ligaments are actually found on the medial surface of the mandible. Those ligaments are found on the medial surface of the mandible. So the first of them is the stylohyoid ligament, or the styloid process, the styloid process of the temporal bone, and there is an important ligament that is attached to that, that is also attached to the medial surface of the mandible. And then we also have right here, I'm sure you can see it right there. All right, that's the spine of the sphenoid. The spine of the sphenoid. I'm sure you can see it right there. That's the spine of the sphenoid. All right. So the spine of the sphenoid attaches to the mandible, and that gives you a ligament there called the spinomandibular ligament. And here is a stylomandibular ligament. So there are two important ligaments, but the reinforcement of these ligaments are not as tough as that of the muscles, the muscle itself in that region. So this is the much we could take in terms of the gross anatomy of the TMJ. We will be looking at the course of the maxillary artery in a short while. Thank you.